Good afternoon, everyone. Thank you for tuning in. My name is Lexi White, and I am the Senior Policy Manager within Our Own Voice National Black Women's Reproductive Justice Agenda. I am the moderator for today's discussion, and you are joining the voices and experiences of Black women in Louisiana on reproductive justice, rights, and health issues, a collaborative polling briefing and responsive discussion hosted by In Our Own Voice National Black Women's Reproductive Justice Agenda in partnership with Women with a Vision. Today, you will hear a presentation on groundbreaking polling data from Black women living in Louisiana on a range of issues that impact their reproductive, sexual, and overall health. We will then engage in a responsive discussion with our very distinguished panelists, followed by a 10-minute audience Q&A, which you will be able to participate in by using the Q&A feature in the chat box, or in the Q&A feature that opens up at the end of the conversation. In Our Own Voice is a national and state partnership of 8 Black women-led reproductive justice organizations, including Black Women for Wellness, Black Women's Health Imperative, New Voices for Reproductive Justice, Sister Love, Sister Reach, Spark Reproductive Justice Now, and Women with a Vision, who you will hear from today. Our work centers the voices and lived experiences of Black women, femmes, and LGBTQ+ people in the ongoing state, national, and regional fights, including policy fights, to achieve reproductive justice for all. Women with a Vision, founded in 1989 and based in Louisiana, is a reproductive justice organization whose work aims to improve the lives of Black women and historically marginalized communities, their families and communities, by addressing the social conditions that hinder their health and well-being through relentless advocacy, health education, supportive services, and community-based participatory research. Today, you will hear from Marcela Howell, President and CEO of In Our Own Voice National Black Women's Reproductive Justice Agenda. Marcela is a strategist, advocate, and leader with over 40 years of experience advocating for women's rights, reproductive justice, and women's empowerment. She is very devoted to enhancing the role of Black women in national policy debates on the issues that impact their lives. You will also hear from Deon Haywood, who is an award-winning human rights defender, activist, educator, and the executive director of Women with a Vision, noted for her work combating discrimination against Black women, the unjust criminalization of sex workers, adverse living conditions against the working poor, and limited access to HIV healthcare for residents living in the South. And you will also hear from Lakeesha Harris, who is the Director of Policy and Reproductive Health and Justice at Women with a Vision, based in New Orleans. As a Black feminist, Lakeesha's primary work centers healthcare access for Black people, specifically queer and trans Black people who are often shut out of services that are culturally affirming and financially accessible. Lakeesha is also a healer whose work has included being a certified nurse assistant, doula, apprentice midwife, and community health worker. Without further ado, it is my sincere pleasure to introduce President and CEO of In Our Own Voice National Black Women's Reproductive Justice Agenda, Marcela Howell.
Thank you, Lexi. And again, thanks everybody for joining us today. The information that I'm going to share is the polling for Black women in Louisiana. It is part of a polling project that we did for 7 states in the Deep South. And I'm going to tell you a little bit about the methodology first and then go into detail about the actual data that we collected. We've commissioned a polling firm called Perry Undum to talk to 500 Black women in each state. And we did Alabama, Arkansas, Kentucky, Louisiana, Mississippi, Tennessee, and Texas. And today we're going to talk specifically about Louisiana. Next slide. As I said, we did 500 Black women ages 18 and up. Of those women, 86% identified themselves as voters, people who had voted in the last 2 elections. Next. In Louisiana, Black people make up 33% of Louisiana population. Of that, 52% are women. The first question we asked was on abortion rights. We wanted to look at Roe v. Wade specifically, since we know that that is an issue, a decision that is in jeopardy right now. And we asked people how they felt about the 1973 Supreme Court decision, which established a woman's constitutional right to have an abortion. We asked them if they would like to see the Supreme Court overturn its Roe v. Wade decision. 64% of those we polled said that they wanted to uphold Roe. 34% said they felt that it should be overturned, and another 2% said they weren't sure. We also asked a question about financial security and whether or not having control over your body was an important issue to financial security. And almost 95% of the women we polled said that they thought having control over childbearing was an important issue when it came to the financial security of themselves and their families. Next. And when you look at where Louisiana Black women stand in terms of poverty and other issues, it is really clear that financial security was an important factor. 30% of Black families in Louisiana live in poverty. 76% of Black families who live in poverty are headed by women. And unlike what most people think, that has very little to do with the education factor. In fact, 82% of Black women have high school diplomas or more in terms of education, yet they live in poverty. And when we delved a little bit deeper, we found out why. Black women in Louisiana make 48 cents to every dollar that a white male makes. What that means is that Black women lose $1,155,990 because of this wage gap over a lifetime. And it also means that in order to make up as much money as a white male who retires at 65, Black women in Louisiana would have to work until they were 104 years old. Now I want to repeat that. In order to make up the amount of money that a white male makes when he retires at the age of 65, Black women in Louisiana would have to work until they were 104. Next. We also asked a question about what things people considered when they were deciding whether or not to have children, whether or not to, or expand their family. 64% said they considered the issue of having a living wage job. 61% said they considered having affordable health care. 60% said racism factored into whether or not they would expand their family or begin their family. 54% said food security. 54% said childcare. Another 53% out of that said affordable housing. And then 42% said over-policing would impact on whether or not they decided to have children. Next. We asked a question about whether or not racism impacts healthcare or their health in general. 47% of the respondents said that racism has a negative effect on their mental and emotional health. 33%, 1/3 of the people said that racism has a negative impact on their physical health. And then when we asked younger women, ages 18 to 34, 57, half of them said that racism had an impact on their mental and emotional health. We asked people about over-policing in Louisiana. 42% of Black women say that over-policing factored into decisions about having children. But younger women, ages 18 to 34, that percentage jumped up to 58% who said over-policing factored into their decisions about whether or not to have a child or to expand their family. We also asked people what kind of support women should get in terms of seeking abortions. 73% said the abortion should be affordable. 73% said the experience should be simple. 70% said the decision had to be respectful. The people who they encountered had to respect their decision. 67% said abortion services should be available in their community. And another 67% said that abortion services should be available as soon as possible. And when you look at some of the laws that are passed in different states that include things like waiting periods or the number of times you have to visit a physician before you can get abortion services, you see that people really do believe that these services should be available in their community. People who are performing the services should be respectful of a woman's decision and not try to talk her out of that decision, and that it should be simple and available as soon as possible. We asked a simple question about whether or not people thought that abortion was legal in Louisiana. 38% said yes, they thought it was legal. 18% said no, and a whopping 44% said they were unsure. And of course, the people who said they were unsure, it is because, again, they hear so much anti-abortion things that are going on, like new laws in their state for waiting periods, or saying that they had to have, in some states, they have to have ultrasounds before they can get an abortion. So 44% of the respondents literally were unsure about whether or not abortion was still legal in their state. And then we asked questions about whether or not they thought the rights were at risk. 61% think that the right to abortion in this country is at risk. 60% said that they thought the ability to get an abortion or the right to get an abortion was at risk in their state, in the state of Louisiana. And then 47% said that they felt that it was getting harder to get an abortion in Louisiana. 13% of them said that they thought it was easier, and 41% felt access is not changing. So it was divided. Next. We asked people about who should be able to make the decision, and it was very clear, 65% of Black women in Louisiana said that the woman or person involved should make the decision about how and when to access abortion. And 53%, half of them said that they were more likely to support candidates who supported abortion rights. And then, of course, we wanted to know about stigma and how people felt about stigma. 75% said that they would reject shame when it came to seeking abortion rights. 73% said that they believed that abortion could be a responsible choice for them. And 56% said that they did not consider seeking an abortion to be a religious issue for them. So it was very clear that the respondents felt that they should have access to abortion, that it should be available in their community, that it should be affordable, and that they would reject being shamed about it, and that they felt that it was a responsible choice for them to make in terms of planning their families. So now I'm going to turn this back over to Lexi to introduce the panelists.
Great, wonderful. Thank you, Marcela. We are going to switch gears to a responsive discussion that responds to the data that Marcela presented. And my first question is for Deon Haywood, who is the Executive Director with Women with a Vision and someone who I really admire in terms of her work and leadership. And Deon, as the fierce leader of Women with a Vision and champion for the healthcare and healthcare battles that Black women are fighting right now on multiple fronts, what resonates with you and the work of Women with a Vision from these polling results that can further tell a story about what Black women in Louisiana really think about reproductive justice, health, and rights issues, you know, including, but certainly not limited to abortion healthcare?
Right. Hi, everyone. Can y'all see me? Make sure I'm right. Okay, so hi, everyone. How are y'all doing? I'm actually really excited about the polling numbers. I think we've come a long way when I look at the numbers and I'm seeing numbers like 70%, 70-something percent or 60% of women feel like it's their right. It is not about religion. That is different from what I would have said I saw 7 years ago here in Louisiana. Also, I think where we are now in terms of being on the ground, the strategy of using and organizing framework to be really present with women in our community across the state and having these conversations has shifted to where we are now, where people have a better understanding of reproductive justice in its fullness. And I would say when it comes to abortion issues, understanding it more as a right than as a religious issue is really big for us. But I think that comes from, like, again, just organizing and really talking to people. The disconnect has happened with people running for office. We're just not on the same page. Louisiana is considered a red state. It's a conservative state. And most lawmakers want to toe the line with what the people want versus who they think has the power to put them in office. And right now they think who has the power might not be people who want abortion.
Thank you, Deon. And Lakeesha, one thing I was thinking likely does not surprise you from this data is that the majority of Black women who responded in the survey indicated that they did not want to see Roe v. Wade overturned. With the recent loss of Supreme Court Justice Ruth Bader Ginsburg and the battles in Louisiana and at the Supreme Court that you have been fearlessly fighting this year and before, what can you share about what's at stake with regards to abortion healthcare and other related issues in Louisiana as we head into this November election?
Well, I first want to thank y'all for hosting this event and also always being such a fierce national partner with Women with a Vision. So what's at stake? We know that, that Donald Trump has put in place Amy Barrett. And I think for the specific reason to bring Roe v. Wade down, as well as attack the ACA. We know that in November, as far as for Louisiana, we have a ballot measure that is coming up for a vote. And this ballot measure is to secure anti-abortion rhetoric within our Constitution, making it illegal for a person to obtain abortion in Louisiana, that Louisiana does not support abortion. And that will be written in our Constitution and hard as heck to pull out once it's there. But Louisiana has what what is called a trigger ban already in place. So the trigger ban, essentially, if Roe is overturned, which is a great possibility coming from the national level, that Roe could possibly be overturned. If Roe is overturned, anybody helping someone to secure an abortion or act as an abortion provider in any capacity can be jailed and fined. And then this measure would make sure that not only the provider or person assisting a person get an abortion, but the person themselves getting an abortion would also be criminalized. So Women with a Vision has always looked at this not just as a bodily autonomy and who has a right to abortion, but what's at stake as far as criminalization of Black bodies and forcing them into the prison industrial complex. So what's at stake is increased criminalization of our people, poor people, Black people, brown people. And we know that we have to beat back this ballot measure, but we also have to continue to, and we are always fighting and exhausted. And I think that is the case for us on the ground as activists here. The trap laws, the innumerable trap laws that come up every session that is voted with fervor across the board, Democrats and Republicans. For me, I can't see the line here as far as when it comes to abortion rights, LGBTQ rights, workers' rights. It all merges, and what the polling data is so instrumental in capturing is that we as a people don't want these things. So who are the officials, these elected officials, really working for?
Thank you, Lakeesha. And, to your point around who our elected officials are working for, we know that, and you all especially know that it's challenging to find lawmakers and leaders who are committed to, the wide breadth and depth of issue areas that Women with a Vision champions through a visionary intersectional framework. And so Deon, I wanted to toss it back to you to help us think through how we address lack of support in Louisiana and build more, both community champions, but also political and legislative champions around these issues. How can lawmakers and community leaders in Louisiana show up for Black women and reproductive justice in these especially challenging times?
Thank you, Lexi. So one of the things that's been important for us is working with lawmakers using our anti-criminalization work to get at reproductive justice. It has been an important tool because in the end, people don't want to say that they didn't support women who are criminalized across the board, from sex work to theft to crimes of what I call crimes of survival, right? And so what we've seen is because we've used anti-criminalization work, bail fund work, and all of these things to open the door with politicians and lawmakers about how we move forward and how we can end the criminalization of Black women. One of the things, for example, this is the first time that we've had a DA's race where people are really excited about a new DA in New Orleans. And so we've been talking to all of the DAs around criminalization of Black women. What does that look like? How do they support and what they are willing to not charge women with? Like not arresting or pressing charges against pregnant women, against sex workers. So we've been on the ground really talking to them, but we find that people, I have to agree with Lakeesha about how we get lawmakers. We're unsure here. We don't have a line. Most people have a clear line between Democrats and Republicans. Here it's the same. So it's why local policy for us here in New Orleans is really important, about building those relationships for people who are going to be representing us in Baton Rouge, and then going to Baton Rouge and trying to do the same thing by working with them. But our power has really been the people. You know, we have days where we go to the Capitol. Those days are important, but we find it is making sure that our people have the information they need so they can speak up, because it's easy for people to say, well, Women with a Vision wants this, not the people. But again, the polling and the data shows that this is not what the people want. So it begins opening up those conversations, making sure people show up at council members or for Zoom calls that we've been having, given that we're in COVID, or trying to get people to contact lawmakers. But it is these moments like this where we have an opportunity to have someone in office that is going to speak for us, that is going to work with changing policy around how women are policed here in Louisiana. And so that's, for me, probably the biggest thing, is just holding people's feet to the fire. Having a new DA is big in New Orleans. As you know, we just came from under a consent decree that's been in place since right after Hurricane Katrina. So this is an opportunity to really, I hate using the word reform, but really change the way criminalization can look, the way policing looks in our communities, and also opening that up for us to do ourselves and to put resources into mental health services, social services that women need for childcare, for education, than what Louisiana and New Orleans have been investing in terms of the people versus the policy.
Thank you, Deon. And I wanted to build a little bit on, holding the reality that right now we're navigating a global health pandemic. Yeah. At the start of this pandemic, I think I read that Black people accounted for 70% of COVID-19 related deaths in Louisiana. They make up 32% of the state's population. Additionally, we know that there are a lot of frontline workers, overwhelmingly Black people, Black women, immigrant women, who are being compared comparatively low wages, before and during this pandemic, while putting their lives at risk. And I've also heard people comparing, the HIV/AIDS epidemic to the COVID-19 crisis, not in terms of the pandemic itself. We know it's a very different healthcare fight, but in terms of which communities we know continue to be left behind, in terms of not getting the comprehensive information they need, the relief they need, and the support they need. Black women, Black and brown, queer and trans communities, sex workers, survivors, immigrant women, and lower wage frontline workers. And so, Lakeesha, I wanted to talk to you and hear from you about, what you see as being unique in the context of this COVID-19 pandemic, with your work and your engagement with community members. What have been some unique challenges that you've seen, and what are some things that you've learned?
Well, for me, what's been vastly unique, and this is the consistent misinformation and doubling down on that misinformation at a national level. So people don't know what to do and what regulations to follow. That was true in the 80s, and I feel like it's exceptionally true now, because we have such a vast array of places in which people can get information, social media, and our president going on social media and in front of national media and giving such, how do I say this, such bad information, okay? And then what I'm seeing also on the ground is the continued violence to Black people at the hands of white racists. We have such entrenchment of white racism, and we're fighting essentially double pandemics. We're fighting COVID, and we're fighting racism, and all of those things are intermingling to make sure that our people die disproportionately. and what I feel is really unique opportunity in which I feel like people of color are living up to the challenges, which is the mutual aid front and getting accurate information out. Women with a Vision has done a lot of mutual aid in communities, especially for sex workers who were left out of the funding, the very basic funding for support from our government. You know, Small Business Association and the federal government excluded, in particular, sex workers from getting relief. And so Women with a Vision stepped up and and partners have stepped up and given, you know, money so that sex workers can take care of their families, pay their rent, eat. Because what we know is when vulnerable communities have to do whatever they need to do to survive, they end up incarcerated and more at risk for COVID-19 and jeopardizing their communities, because many on the ground here in Louisiana, and I'm sure that this is nationally, many poor families are grouped together intergenerationally in small spaces and putting each other at risk for COVID, but they do what they have to do to survive. And so those challenges of non-financial support, misinformation, we know this to be true through the HIV crisis, and also true that we are supporting communities the best way we know how and really getting out there with the mutual aid and support.
Lexi, I wanted to add also here in Louisiana, because we're, I think this is our 10th hurricane scare this week that we are in and preparing for, that here in New Orleans, we have 12,000 people who are housed in New Orleans in hotels from Lake Charles, Louisiana, who again, majority of those people, from what we've seen, look like Black people, from just going down to the hotels, our harm reduction team going down, seeing how we can help out. And we're seeing a repeat of who's gonna, and I hate to use that word, but who's gonna suffer are Black and poor people, because that's for the most part who is displaced and who's here. So in the middle of a pandemic, where people should be quarantined, we have 12,000 people in our city from an entirely different city that's actually 4 hours away, and have lost their homes and lost resources and nowhere to go for living here. And that's also when you think about polling and voting, you're thinking about the Black vote, what's gonna happen with these people who've been displaced from what is considered a rural area. And people aren't just displaced here in New Orleans. There are people living in Baton Rouge as well who are displaced from Lake Charles, Louisiana. And majority of those people that we see are women and children. So, you know, when you think about how those people, how they're gonna make it to the poll, who's been talking to them, we've tried, but then again, we know that everything you try doesn't always, you know, people are not getting mail. They didn't have a chance to forward mail. And I think we've done better at what happens for national disasters like this for hurricane season, but how that displacement affects healthcare, how it affects mental health care, as well as you're talking about 12,000 people who probably displaced from their jobs and their living address. And what were they earning in Lake Charles, where majority of the people in Lake Charles, Black people lived in poverty in Lake Charles, Louisiana. And at this point, they're not even on the grid. They're electrical, nothing is repaired. So we're seeing a repeat in Lake Charles to what happened here in New Orleans after Hurricane Katrina, with displacement and how that affects voting, mental and physical health care. And so it'll be interesting to see how this plays out for the rest of the year. And as we get closer to the elections, about a large number of people not being able to even vote.
And to that right, Deon. What about, I mean, when we're thinking about voter suppression and voting, the large majority of people who died from COVID were Black people. That is a lack of Black votes at the polls.
Exactly.
Like, we're not really, I think that when I say we, I mean nationally, what it means to have, at this point, 210,000 people who could have possibly voted now dead.
Yeah.
So Marcela, I want to come back to you on this theme that we're talking about with regards to voter suppression. It's running rampant right now, especially in the Deep South. I saw that on National Voter Registration Day, for example, the online voter registration portal in Louisiana was shut down. And that's just one of many examples. Marcela, what is voter suppression? What's at stake from your lens nationally this election? And how are the Black leaders within the In Our Own Voice partnership and the reproductive justice movement more broadly gearing up for this election? I keep seeing, make a plan, make a plan.
Right.
Tell us more about what it means to make a plan as we get ready for November.
Well, voter suppression is real. We know that. We know that there are laws that are being enacted, have been enacted by state legislatures to basically put up barriers for people to vote who are Black, Hispanic, young people, even seniors at this point are being, because of all the different kinds of things you have to go through. And in the era of COVID, one would think in this country, people would encourage people to do mail-in voting. But instead, what we've had is the post office trying to slow down the mail. We've got legal challenges against people being able to vote by mail. We just lost a Supreme Court case where that had to do with whether or not you had to have a witness sign your absentee ballot. And the court basically said, yeah, you still have to, even though we have COVID and you're supposed to be social distancing. So voter suppression is real, and it has always been targeted at Black voters. And one of the things that we've been encouraging and that other groups working to turn out Black voters have encouraged is that people make a plan. You decide how you're gonna vote. If you decide you're gonna vote by mail, you make sure you get your absentee ballot early, and once it comes, you fill it out and you either mail it in or you take it to one of these drop boxes that some states have set up. And then some states are limiting the number of drop boxes you have there so that they don't get enough people. You get your ballot, you think you're gonna just drop it at a box and then you can't find one. There is that. That's if you're going to vote absentee. 42 states have early voting. So the other point is you do early voting. And if you've seen some of the lines, even early voters have to stand in line for a couple of hours. I always vote early, and I always go on the first day in Maryland to vote early. But I've never had to wait. I've always gone in and there's maybe about 20 people and there's no real wait. I have no clue what it's going to be like this time. So there's early voting. And then there's going to the polls on election day. And many people have said, if you're going to vote on election day, pack your lunch. And in some cases, you might want to pack dinner too, because the lines will be long. Because part of voter suppression is to cut out the number of polling places you have. And so you go to these polls where you've always been able to vote, and they've combined different, polling places into one, so the lines are longer. So that if you are a senior and you gear up with your mask and everything that you're supposed to have to protect yourself from COVID, and you decide you're going to stand in line, the lines are long, and how long you can stand there depends a lot on your age. So if you have any, or if you have any kind of disability and you can't really stand online for a long time, there are numerous things that people who are conservative legislatures have put in place to stop Black voters from voting. And we see that across the country. And again, that's what making a plan means. If you're going to vote, decide how you're going to vote, make a plan, make sure you know all the details about when you can go and vote, what the guidelines are for voting by mail, and what the guidelines are for voting early. And then you share your plan with your friends and families and have them accompany you to the polls, so that if you do have to wait in a long line, you at least have somebody you can talk to, and you have some snacks, something to drink. A lot of people who are running for office are going to be providing like water for people online to keep them so that they will stay and vote. And the reality is, this is an important election. There's a lot at stake here. And we have to be willing to come out and vote.
And I wonder, you know, from our panelists, any reflections you have around using voting power as a tool for the issue advocacy, right? To get the awareness out around the ballot measure that's coming up. Do you find that, you know, building voting power is effective in reaching communities who are interested in plugging in to your mobilization efforts?
I would say it's critical. You know, it's a critical avenue to get people, one, to know what's on a ballot. We just had what's on a ballot information session, as well as a voter registration drive in front of our building where people could pull up, and our team that is a part of our voter education program just took their information down and registered them right then and there. But we have, beyond Amendment 1, we have several other issues on the ballot that could impact the way people navigate living here in Louisiana. And so we have been educating on the issues. And quite frankly, the other side has the ability to put more messaging out because of what's going on with funding. So we are doing critical work. It's hard work. We are educating the community on what's at stake beyond just the candidates, although those candidates are instrumental in changing the landscape here in Louisiana, and letting people know. So I think it's critical. And it's yet another avenue to continue educating the community.
I'm sorry.
Go ahead.
No, I was going to add that one of the things that we have been trying to do is get people hired as co-workers, people from the community, because I think we have a shortage now on poll workers, what I never thought I'd see here. But majority of people who work the polls here in Louisiana are elderly people. And these are women that have probably been in place at these polls for most of my adult life and most of my voting life. And now because of COVID, you know, they're not working the polls because they feel like they're at risk. So there's been a push to train people, to hire people, and we've been trying to put that information out so that we can make sure that the voting sites that people can attend are well staffed. But that's been across the state. And I know here in New Orleans, I haven't heard about too many changes in polling sites, but across the state we have heard where they're, again, I keep bringing up Lake Charles, but they don't have any polling sites set up right now. you're talking about entire parish, entire.
I think Deon may be frozen.
Yeah. Yeah, I think Deon is, her thing is frozen.
I'm still here, Lexi, if you need more questions.
Well, on our topic of building voting power, I did want to take the opportunity to plug www.blackwomen.vote, which is a national website where In Our Own Voice, in collaboration with our partners, have lifted up the state voting requirements of each state. There's this really awesome digital map feature that you can check out, and that can help you to make your voting plan as you gear up for this November. I know, unfortunately, Marcela has to leave us a few minutes early today, and we're almost at that mark. So Marcela, I wanted to give you an opportunity to say any final words with regards to today's discussion and the work that lies ahead.
Well, I think, thank you for mentioning the blackwomen.vote. For people who want to find out about their own state, what the laws are, when the dates are for early voting and others, you can go on there. There's a map. You just click on your state and it'll go to a page that tells you all about the voting in your own state. It also allows you to check your registration, because that's the other piece. That's the piece I did not mention in terms of voter suppression, is that in a lot of states, they are purging the voting rolls. And so you need to go on, make sure you are still registered before the deadline passes for registration, because there have been instances where people who have voted every single time, and then they show up at the polls and they find their name is no longer on there. And the state will say, well, we sent you a postcard and you didn't respond. So you need to make sure, that's part of the voting plan, is to make sure that you are still registered, make sure that people in your family are still registered. And then, as I said, make a plan to vote, because you never know exactly what's going to be a barrier, and you need to know exactly what the laws are to voting. This election is really important. At this point, there is so much at stake, just in terms of the issues that impact Black communities. There is just so much at stake, and we have to make sure that we register. And then we also make sure that you've filled out your census pieces as well, because it's really important that you get counted in the census. And so that's the stuff I would like to leave finally.
Well, thank you so much, Marcela, for joining us and for your presentation today. We are going to switch gears to audience Q&A, where folks can chat, type into the Q&A chat box in order to pose questions. And I'm actually getting a message from Deon saying her power just went out. So I'll see if we can bring Deon in over the phone. If not, Lakeesha, I know you'll be able to hold it down, and we'll stick around a bit longer to get some audience questions. Thanks, Marcela.
Yeah. I would like to just tell people that we are in the middle of hurricane preparedness, which Hurricane Delta will be here on Friday. So things are a little shaky for each of us right now. So.
Okay. So I see a question. How can we use polling data to enhance our advocacy efforts?
So one of the ways that you can use polling data to enhance the advocacy efforts is definitely engaging more with your elected officials and presenting the data and letting them know that you know that, one, Black women don't want a more hindrance to abortion, advocacy. Hindrance to abortion access. And two, that that we are underpaid. I think that was so critical. When I looked at the data and knowing that Black women are underpaid and mostly the head of the families, and that we would have to make work until we're 104 years old to even reach the point of equity and pay. If when a white man sits on his rear at 65, that is a stark contrast when you think about we are not living as long. Black women are dying in childbirth. Black women are, Black lives are at stake in the street. We're dying disproportionately during COVID. That means that we are not leaving behind anything to our descendants, our people. And so I just feel like we can utilize this data to really talk to our elected officials and talk to our community, and let them know what's really at stake when we go to the polls, because so many people are just feeling jaded by the electoral system and not getting what it is we need to support our families and support our communities.
Thank you, Lakeesha. And so seeing no more audience Q&A questions, I just wanted to give you an opportunity to let the folks know where they can follow Women with a Vision and how they can keep in touch.
So you can definitely go to our social media pages on Facebook and Instagram. That's Women with a Vision -NO. And that's and go to our website, which is www.wav-no.org. You can also be on the lookout for us to post signs against ballot amendment number 1. And if you go to the Louisiana for Personal Freedoms website, you'll get more information on what ballot amendment number 1 is and how we are working to defeat it. We are going to be producing yard signs because we see a lot of anti-abortion advocates having their yard signs and getting out information. We would just like for you to support the work that we are doing and plug in any way or any capacity that you can.
Thank you, Lakeesha. And I actually see one more question. Are you good with one more question from the Q&A?
Yeah, sure, absolutely.
So how are you working to hold elected officials accountable for abortion and other laws that are not aligned with the majority view that abortion should be legal and accessible?
So we have been, like Deon previously said, we have been going to the Capitol for years now. And we have been writing op-eds for years now, and calling out those people like Katrina Jackson, who's a Democrat, who has been a part of presenting trap laws, as well as this ballot amendment. She was the primary on this ballot amendment and pushing it forward. So we have been, Women with a Vision and the rest of our coalition members, which is Lift Louisiana, New Orleans Abortion Fund, Planned Parenthood Gulf Coast, and now Baton Rouge, as well as Reject. We have been pushing out that information and disseminating that information community-wide. We have held rallies. We have been doing a lot, as well as going to city council and tapping our allies who are public officials to have critical conversation amongst their legislative teams and, colleagues to try to defeat some of this. Bottom line is we're in a very conservative state. I think that LaToya Cantrell said it best. This is New Orleans, and the rest is Louisiana. And we are really fighting in New Orleans, which is a blue city, in a very red state. And the Christian, and I should say not the Christian, but the conservative agenda is to push amendments that controls bodies, incarcerate our people, and do that by any means necessary, even if that means death and force. So I hope that answers the question.
It does. Thank you, Lakeesha and Deon. I see you're able to join us. Sorry that your power went out. I think you're actually on mute.
Yeah, I'm back. Sorry.
No worries. So we have 5 minutes left. I see two more questions in chat that I can tie together. And then Deon, I wanted to make sure that you have the last word on any calls to action that you'd like to leave our viewers with today. But the last couple of questions I see are, how do we specifically engage young people and young voters right now? Are you concerned that voters will be challenged or blocked from voting? I know we already talked about that, but we know Trump made this comment around asking people to watch the polls, including the Proud Boys, right, the white supremacists.
Right.
And so, I just wanted to acknowledge that and see if you had any reactions to that.
So I think there are a lot of, and Keisha probably said this part already, but there's a lot that not only are we doing, but other people here where their work is around voting and young people. So I think everybody on the ground is doing the very best that they can to reach out to people. I actually think that this time I'm seeing more young people be engaged in this whole process or the idea of voting and what it means than I've seen in the past. And again, I think that comes from organizing and people really being in community and doing that work. I think about Proud Boys again, and this is, we make a joke about it, but this is New Orleans. There's certain things that do not happen in the New Orleans, as we say here. Proud Boys not gonna come and block anything in New Orleans. If they do, it'll be Metairie, Louisiana. It'll be Jefferson, anywhere in Jefferson Parish. But New Orleans historically has been seen as a battleground and also a place where Black people hold their space and they're not afraid of the Proud Boys. And so with that being said, I don't have that fear for New Orleans, but I wouldn't be surprised because we've seen it happen before this moment of Trump. And I think that people give, there's a reason why we talk about him a lot and what the effects of him being in office. But we've seen many of those things happen here before he was ever in office, because this is Louisiana. So people have been blocked before. People have been, like they get there, you've been voting for, 70-year-old people are going to vote and all of a sudden your name is not on the list or your ID is not right. We've been seeing those things throughout Louisiana before he was in office. But I think that people are more vigilant and people are preparing themselves. It's kind of like what Marcela said about prepare yourselves when you're going to the poll. Be ready, pay attention to what's happening around you, bring somebody with you, so you're not alone. You don't have that fear of what it will mean in the age of Trump in this year of our Lord 2020, fear going to the polls. And so I think that people are prepared, but I think again, New Orleans is New Orleans. And we haven't seen that kind of activity here. But I do have that fear for the rest of Louisiana. And I'm really concerned about yet another hurricane coming in. And they may seem minimal, but it does displace people. Like when you think about displacement, New Orleans lost so many people after Hurricane Katrina, and many of those people never came back, which meant we lost some voting power to me in terms of Black vote. And what it's meant to rebuild that over the years. And now people being stuck in that situation yet again, just from more of a central Louisiana standpoint. And so I think it's going to be important. We've done a couple of activities. Our other partners have done other activities here in New Orleans and in the state to get people out. And I think we're just going to have to continue to do more of that in terms of preparing community and I'm really glad about the signs because I feel like people like Katrina Jackson, they have all the resources to confuse people on that day around these amendments. And so I'm hoping that we will be able to do the very best we can breaking that down for people. And we've talked about how can we simplify it? How can we not have people trying to go through 3 pages of around one thing when they're confused already, and they purposely make them confusing. So just trying to make sure that people have what they need when they go out to the polls.
And then also, Deon, to add, I feel like a means of voter suppression is not giving people stimulus money so that they can eat, so that they can pay their rent. Like, I feel like people are not understanding the depth to which people are surviving just to do whatever they need to do to survive. So if they're focused on surviving, they're not focused on going to the polls. So people were focused solely on surviving before this, with Black women only making 48 cents on the dollar. If you lost your job, you don't have support from the government. They've canceled the moratorium on evictions, so people are worried and concerned about housing. You know, this is a travesty, and it is one meant to keep people from the polls.
Well, thank you so much, Lakeesha and Deon. So much wisdom imparted in this conversation today. We want to encourage all of our followers to follow Women with a Vision on social media. And we will also be sharing this webinar as well as the polling data that we covered on our website at Black Women's RJ in the near future. So we encourage everyone to follow us, to visit www.blackwomen.vote to make your voting plan. And we look forward to continuing to fight the good fight, and Women with a Vision. Thank you so much today for your time.
Thank you, Lexi. We appreciate you. Love you.
Love you all. We'll talk to you soon.
Bye-bye.
Bye-bye.